Hello, everyone, and welcome to the Washington West African Community Podcast. My name is Sahara. I will be your host today, and here with me, I have our leader, Pa Usman Diouf. I also have with me two of our wonderful healthcare professionals, and I have with me Janessa Labello. Would you mind introducing yourself for our audience, please?
Absolutely. I'm Janessa. I'm a public health nurse on the Communicable Disease Surveillance and Response team at Snohomish County Health Department.
And I also have with us our lovely Carrie Parker here. And would you be introducing for us what you do?
Of course. My name is Carrie, and I am an assistant director at the Health Department for our Prevention Services Division. And I also acted as the incident commander for our most recent measles response.
Oh, and that was in January, correct?
Correct.
And is that measles outbreak still going on?
That outbreak was considered resolved in April, but we spent a good 3 to 4 months responding to the outbreak. We ended up having 14 cases that were identified here in our county. They were from various households in various cities, but they did all have a common exposure site that was linked to some visitors we had over the holidays that visited us from South Carolina, who was also experiencing an outbreak and ended up being here while they were contagious in their contagious period.
Oh my goodness. Wow. Okay. And I did want to ask, what are some common symptoms associated with the measles disease? Something that we can look out for?
Oh, that's just so
Yeah. Nurse Janessa.
So measles is a viral disease, meaning that it is transmitted airborne. Symptoms to watch for would be initially a prodromal stage, we call it. It's a fever associated with the 3 C's or one of the 3 C's: cough, coryza, or like run nose, congestion, and conjunctivitis, so like the goopy pink eye look. One of those 3 C's and a high fever for 2 to 4 days, and then the onset of a rash, especially in an unvaccinated individual, will be the stereotypical measles rash. It starts at the hairline, works its way down the body like a window shade. The rash is not itchy either, so those are kind of the symptoms. A lot of people think that they just have a cold and then they get the onset of rash and will notify us. We would initiate testing, which happens through our public health laboratories in Shoreline in Washington, and the individual would then be sent home to isolate until those results are available, or at least until they are out of their contagious period for the rash, which is 4 days post-rash.
So I'd like to ask, how long are you sick for when you do catch the measles, and how long are you contagious for?
Great question. So typically someone that contracts measles is sick for 7 to 10 days. And the contagious period is really 4 to 5 days before the early symptoms. So fever and the 3 C's, cough, conjunctivitis, and the congestion, runny nose, until 4 days after the rash starts. And measles is very, very contagious. Again, it's transmitted airborne. So if someone is in a room and they're coughing or sneezing or anything, and those particles are suspended, and then they leave the room, the measles virus is still present for up to 2 hours in that room. So anyone that comes in after them within those 2 hours can get measles. And so we are really concerned with that 4 to 5 day window early, and then the 4 days after the rash starts. During the contact tracing, we do ask where people were and what time frame. That's where we gather those lists and let people know, hey, you had an exposure. So it can be a very big deal. And for individuals that are immunocompromised, so those that have previous medical conditions, that have a weakened immune system, pregnant women that can't get vaccinated, and babies under 6 months that also can't get vaccinated, we are really concerned about that population. So, yeah.
So it's important to get vaccinated.
With measles only lasting that 7 to 10 day period, a lot of people don't see the concern for it. They don't find it very alarming just because the rash goes away. However, there are complications that can happen after the fact, a lot of times later on in life. So individuals that have secondary infections from also having measles, they can have an ear infection, a middle ear infection, especially with that high fever, pneumonia, encephalitis, which is brain swelling. And in 1 to 3 out of 1,000 cases in the US, it can lead to death. So it is a very big deal.
Okay. That is very good to know. Thank you very much. Okay, that's really good information to know. And I do want to ask, how could we prevent such a viral disease or such a contagious disease?
The first way of prevention is to be vaccinated. The MMR is 2 doses, and that's really important and honestly the best prevention. It's 97% effective with those 2 doses, so a very high success rate. And the other is to stay home when you're sick.
Okay, so to isolate, it's very important. And if someone were seeking the vaccination, where would they go?
I think that if they're able to see their family physician or their primary physician is always the first choice, so that they're at their medical home. But if they don't have a primary physician or a home physician, or they're not able to afford it, they can contact the health department and we can connect them with services or provide vaccine on site there.
Okay.
And if they call our number, which is 425-339-5200, we can help get them connected for services.
Wonderful. It's great to know where we can access resources. And I did want to ask, do you believe people in our community should still get vaccinated even if they feel the fear of getting vaccinated?
Of course, especially on outbreaks like measles
Yes.
or COVID and other diseases that, of course, the vaccine can prevent. I am not a nurse, but I believe there are some vaccines that are available at an early age that need to be taken. In fact, the schools are very particular about those shots, and it's very important for parents to take them serious to protect their kids and protect other members of the community as well.
Absolutely.
One of the biggest challenges from the outbreak that we had was measles is so very contagious if you're not vaccinated. Amongst a room of unvaccinated people, 9 of 10 are going to come down with the measles if they're exposed.
Oh my
So
goodness.
measles, being vaccinated provides such important protection. And the other thing that other folks don't realize is that if they're not vaccinated and they have an exposure, they need to still isolate for the full 21 days while they wait to see if they develop illness so that they don't expose others during that incubation period. So, for example, during our last outbreak, we had some school exposures. And so when we had teachers or staff or children that weren't able to prove vaccine, they had to be pulled back from work or school in some cases to wait out that entire incubation period. So it can be very disruptive to families and to life and to your education.
So if I may raise a question to that, what happens if you are already isolating and you're not vaccinated? Should you seek vaccination or should you call a medical professional?
Once you've had an exposure,
Mhm.
you have a 72-hour window where you can get vaccinated, and that can help prevent or lessen any potential illness. But after that short window, vaccine would no longer be effective until you are outside of that window for that particular exposure.
Okay, so you would just have to kind of wait it out.
Still have to wait it
All
out.
right, wait it out and stay isolated.
Yes.
That is very good to know.
Trying to build that rapport is difficult. So you have to be very empathetic. You have to be understanding. I have called multiple people and their initial reaction is just to start crying because they don't understand and they're scared. And it really comes down to just listening to them, hearing their concerns. Why are you concerned? I have answers for you, but I want to give you that space to feel your emotions and it's going to be okay. Like, let's work together to try and either get you an MMR within that 72 hours, or these are the symptoms that you need to watch for. I'll be checking in with you periodically to make sure that you're okay. I've also had a contact that it was her daughter's first birthday and her daughter had been exposed and how to navigate that. And that was a situation where I said, you have this party planned. I know you probably wanted a big one, but you can do a family celebration as long as they're vaccinated. And as I said, 97% vaccination status or vaccination efficacy.
Yeah.
So if your family is vaccinated, they can come and celebrate a first birthday. You don't have to completely cancel it. But building that rapport is very difficult and very challenging. And for providers and nurses, even in the healthcare setting, for vaccinations and encouraging people to get vaccinated, it really is active listening. And why are you concerned? And what questions do you have? What makes you concerned about the vaccine? What are some things that I can answer for you? What are resources that I can send to you so that you can do your own research?
Yeah, okay. So positioning yourself in a place of knowledge and having empathy while having that knowledge.
Exactly.
That's beautiful. Absolutely. I think we here at the Washington West African Center, we do a lot to build a connection between our community and health resources as well as health education. So we are here today to educate the public as well as offer them the resources. We have provided that phone number, which will be very helpful if anyone's seeking vaccination. And then, Pa, I would like to ask you, what would your community like to see nurse professionals do to make you feel more comfortable opening up to a doctor or going into a doctor at all?
So, just for contextual purposes, West Africa is home to 16 countries.
Yes.
Over half of which are colonized by France and 2 were colonized by Portugal. People from those countries, when they come to the United States, the first and biggest challenge they have is language barrier.
Yeah.
Because either if they have been to school, they are able to speak and write French or Portuguese, or if they've not had any formal education, they only speak their native language.
Yeah.
So being able to have access to care in your language is very important.
Yeah.
We have a lot of our community members that want to have access to medical resources and they cannot communicate themselves.
Yeah.
Sometimes even if they want to seek the service, but they cannot just express themselves.
Mm-hmm.
Sometimes we have hospitals and healthcare providers that would provide translators, but if the translator is not does not speak the dialect that the patient speaks, that is a recipe for disaster.
Yeah.
Because it can lead to the wrong diagnosis of the person if they are translated, whatever they are saying is translated wrongly. The healthcare provider is only going to go off of what the translator is saying.
Yeah.
So language is a big issue. And if we're talking about vaccines, historically there is a reason why our communities are hesitant, because for the longest we've been used as guinea pigs.
Yes.
From back home.
Mm-hmm.
For when it comes to vaccines, and vaccines that were being tried on, they were mostly tried on our people.
Yeah.
And it makes us hesitate a lot.
Mm-hmm.
So I think what we are currently doing is the way forward.
Yes.
Number one, working with and partnering with communities like us who are trusted messengers
Mm-hmm.
is very important.
Yes.
Being able to talk to the community in the languages that they understand. We are doing this podcast, learning a lot. You said it, we all learn a lot. When we finish, for example, working with the county health department, when the outbreak happened, they work with us to produce outreach in the 5 most spoken West African languages. We translated some of this content in the 5 most spoken West African languages. We are here doing the podcast. We also have this beautiful banner that we are taking to all the events, community events that we are going to, to actually educate the community, to talk to them about it. Individually, when they come in here, whether it's for food distribution and all the other programs that we have. So you are meeting the community where they are by actually coming to us. Mm-hmm. We are not just organizing a talk forum to say, come and listen to measles. They're not going to come because they're busy working 1, 2, 3 jobs. They have their kids' activities to do and other things. But if we're giving out food here, that's something they need. So by providing them with the stuff that they need, you are able to use the opportunity to educate them about the measles outbreak, the MMR, and all the stuff that are actually necessary for the community to know. So education is key, especially in the language that the community understands.
Absolutely. That's a very good point. So definitely we should work on making more health information accessible in all sorts of languages. That's perfect. So I just wanted to ask, is there anyone who cannot receive the vaccine or who is ineligible for the vaccine?
I'm glad you asked. The vaccine is a live virus vaccine, so pregnant women are unable to get it. It's part of the reason that it is recommended to get in postpartum. Actually, nurses in the hospital will ask if they want the MMR vaccine before they're discharged home with a newborn baby. Additionally, infants under 12 months cannot get it. The typical schedule is one between 12 and 15 months of age, and the second dose between 4 and 6 years old. The caveat to that is if you are planning any travel with an infant 12 months or under, they can get one MMR if they are between 6 months and 12 months. Anything younger than 6 months, unfortunately, the MMR is not available for them.
Okay, that makes complete sense. That is very good information to know. And here I'd like to ask Pa specifically, what has the Washington West African Center done to connect West Africans to health education and health resources?
Thank you. That's a very good question. So since our inception,
Yes.
but more so from 2023 up to 2030, the Washington West African Center has 4 priority areas: housing justice, food justice, building community power, and healthcare access. So bringing healthcare resources and information to the community is part of our priorities. And everything we do, the 12 or more structured programs we have, are geared towards achieving, working towards these 4 priority areas. So I would say since our inception, we've been very passionate. For example, through our partnership with the University of Washington, over the years, UW students and our media department have created dozens of healthcare resources. And I'm talking about flyers, brochure, etc. We have created videos in over 15 different West African languages. And of course, over 100 videos in 15 different languages promoting healthcare and talking about healthcare related issues. During COVID, we organized and participated in 30 different vaccine clinics, leading to over 5,000 West Africans in the state being vaccinated. Mm-hmm. We partnered with DOH to do that outreach. Of course, we created songs using very prominent and influential West African musicians to promote the COVID vaccine. Mm-hmm. We partnered with social media influencers to actually create skits. During COVID, I remember one of the big ones, we had a message that was circulating that stated that, okay, if anybody takes the vaccine, it's going to turn them into zombies within 2 years. Yeah. And it was big. We have a lot of misinformation and misconceptions and misinformation that was circulating on social media, especially through WhatsApp and TikTok. And the community was believing in these things. Mm-hmm. So we were creating videos in real time to debunk some of these messages based on the facts we came from the experts. And that was very important because it led to the vaccines. Not only that, we had access to vaccines. When the county was going to roll out the vaccines, the county executive, together with the health department leadership and all the big stakeholders in the health sector, had a meeting with the BIPOC leaders. They told us how they intended to roll out the vaccine. Mm-hmm. By the time they finished the presentation, I interjected and thanked the executive and the leadership, and I told them how the plan they had was not inclusive of our community.
Yeah.
Because they talk about how they intended to go to the over 700 senior living facilities in the county, how they intended to go to schools and all the places where they could be reached. Yeah. And I told them, we bring our parents here, but they live with us. My mom included, she lives with me at my house. She doesn't live in a family home or a senior living facility, nursing home. How can she have access to vaccine?
Yeah.
So we told them about our kids that are attending madrasas, which is the Islamic schools, and some that are homeschooled and other people. I said, how would they have access to vaccination? Yeah. of course, when I finished intervening, all the immigrants, most of the immigrants in the room could relate to what I said, and they reinforced my thoughts. This led to the county rolling out the first 1,000 doses of vaccines given to the BIPAC communities. And we were given access to early vaccination to take our community to the Arlington Airport, the Monroe State Fairground. We are going to Providence Hospital. We could enroll our community members, and they had access to vaccines at that early stage, especially the seniors, the vulnerable population, etc. And that was very helpful working with the county, and we've had an amazing relationship. All the vaccines that I said, the clinics that we organized, the 30 clinics were mostly done in partnership with the Snohomish Health Department, the DOH Care Van, and others, of course, which met the community where they were. We went to mosque. We've organized it at the ICOPS Masjid here in Linwood, multiple. We've organized it at our former office space in Linwood. We've organized some activities at the Bilal Islamic Center. We've organized activities at Nema Church in Everett. So we met the community where they were and provided incentives, provided transportation, provided people access to language interpretation, provided gift cards, provided childcare, provided food, the things that would actually make people want to come get vaccinated. So those 5,000 people were not just because, vaccines were available. We provided the right environment support and resources for people to want to take it. Since then, of course, we've worked with the health department. Last year, I remember we had a partnership. They supported us to have 6 navigators, community resource navigators. That was very helpful. We worked with Pia and her team to get that. And that was very important to provide that. They are trained navigators. We work with Seattle and King County Public Health annually and the Snohomish County Health Department to do our annual health fair. This year, the date is already, chosen. It's going to be December 5th. In December, during the school break, is when we used to do it, during which the Seattle and King County Public Health comes to give, help community members apply for insurance, health insurance. The Snohomish Health Department brings vaccine, and the care van brings the health screening. And this year we are thinking of including mammogram tests, vision, dental, and all the other things to grow it. That has been a very effective way of contributing towards, providing health education. And of course, all the other out that we are creating regularly, whether it's through DOH and all the other people. In fact, I have the Secretary of Health, Dennis Washam, that should be coming here in July. To pay us a visit, and we used to have a good partnership from when he was, the director at the Snohomish Health Department.
Wow. That's all very impressive. So what I'm hearing is it's very important to create a space that is full of knowledge, first of all, and then full of an ability to reach the community. So here at Washington West African Center, we have a perfect place, a perfect blend of knowledge and empathy, and the ability to reach a community that is very often overlooked. Especially, I do want to go back to you talking about immigrants in particular. I know that it is especially hard for immigrants to seek medical care and health care, but I would just like to highlight that in a lot of areas, you can seek healthcare without it impacting your immigration status. That said, I would like to ask our nurse here, have you had any experience helping somebody who is an immigrant?
Not specifically for measles, although we come across a few communities that have a lot of vaccine hesitancy because of their immigration status and having a distrust for the healthcare system in general and government entities, unfortunately. And so the Community Navigator program that the health department has is very, very helpful in reaching that community, in sharing resources, in educating. And we work in partnership with that program on the CD team for medication prophylaxis, for contact tracing. Carrie mentioned that there was one particular exposure site that was an instance where we heavily relied on the Community Navigator program. We found it very difficult to reach that community, and with the navigators, we were able to make contact and provide resources and information above what we could have done on the phone.
Okay.
Mhm.
That is very good to know. Yeah.
So the hesitancy that she talks about, as I said, is a combination of several different reasons.
Mhm.
Yeah.
And this immigration status is one thing. What we tell healthcare providers, what we tell policymakers at all levels is that it's very important that our communities are protected and included
Mhm.
and given access to healthcare. Because we are talking about these things that are very contagious. During COVID, we all learned a lesson. We knew that no one was safe until we were all safe.
Yeah.
And everybody did work together.
Mhm.
Because if immigrants are isolated, if immigrants are excluded, if immigrants are not given access to healthcare, at the end of the day, if somebody contains measles, they will go out in the public.
Yeah.
It's the fact of the matter is that immigrants are working in a lot of places, taking care of your food. I mean, whether it's at the grocery stores, whether it's at the farms, whether it's at so many different places. Uber, they're providing transportation. So many different services in this country are provided by the immigrant community. If they are not protected, if they are not educated, if they are not informed, if they don't have access to these resources, they still live here.
Yeah.
So it is a collective responsibility to make sure that immigrants and everybody else are given access to similar opportunities so that you could also be protected, even if you don't do it for us. But our people are hesitant because over the years we have heard information being circulated. Folks are hesitant. Just last year, there was a lot of fight and advocacy that we did as, non-profit organizations when we hear DHS, for example, sharing information with immigration, and then ICE was using that information to provide immigration enforcement. So our communities are hesitant to actually go and seek medical attention because if you go there, one of the first things that is done at the hospital, the clinic, or anywhere is collect data.
Yeah.
So people don't know what you all use this data for. And as a result, are just hesitant, which is why coming to work with organizations like us are important and make sure that we are very clear to the community to let them know. In the early days of doing what we do, we were being accused of being used by governments, being used by white people against our own people.
Mm-hmm.
But of course, with consistency and reality, we don't go into any type of deals or partnership for our community in any way, shape, or form that would hurt us. We put the community's needs first, we put the community situation, and we have walked away from deals that we thought were fishy and can actually lead to problems for the community at the end of the day. But the immigration thing is key, and there needs to continue to be this conversation. Just a few months ago, I accompanied somebody in an ambulance, and they were being transported to a hospital. And one of the first things, I was so glad that I was in that ambulance because the person brought out a flip chart, a chart, and then was asking them questions, and they were filling it out. The patient was telling them, and they were filling it out. And at some point, they asked them, "Are you a U.S. citizen?" And I had to intervene. I said, "Wait a minute, what?" I said, "Are you a U.S. citizen?" I said, "Why are you asking them that question? When has that become important?" Like, I'm sorry, that's one of the questions we have to ask. I had to engage them. These things can actually scare immigrants from going to participate in these things because anything that is on our way to citizenship or to immigration benefits, we would rather not take it.
Mhm.
And if we don't, it may end up causing the greater society problems.
Mhm.
So it's very important to have these conversations and these partnerships work together to see how we can have these resources available to immigrants.
Absolutely. And then just to 100% put it out there, there are resources for immigrants, right? If we were looking, we can find any sort of resource to find medical care. So if an immigrant were searching for medical care, would they be able to find something accessible?
We do have a refugee health program that has some resources that can be shared if folks are having a hard time finding a medical home or medical resources that they need or medical resources that are accessible to them. We can also work with our Community Navigators program and get language resources available for folks. So we really just would like to encourage the community know that we are a resource for them. We are here to serve them, to protect them, and to keep our community safe as a whole.
That's wonderful. Absolutely. All right. Well, I think we can move on to closing statements. I'd like to thank the Snohomish County Health Department for coming here for your time. Pa, do you have closing statements you'd like to leave with our community before you go?
Well, just to reassure them that we are here for the community. We are a buy and for organization, and we are here for the community. We are here to advocate for the community. We are here to make sure that their needs are met and will not put them through anything that we believe is going to hurt the community. And our partnership with the health department has been going on for years, and we have an amazing relationship with them. I mean, different sectors or subdivisions within the county health department, both Seattle and King County Public Health and Snohomish Health Department, and want to assure them that they can take advantage of these things. They let them not hesitate to take the MMR vaccine, because as we have heard from the experts, it's the most effective preventive measure against measles, mumps and rubella, and it's very important that they get vaccinated. They are not sure of it. They have questions. They can come to us. We have the language resources. We have the, we can provide transportation. We can provide, childcare and other things that they may actually need to be able to have access to the MMR vaccine. It is very important that they do so. On December 5th, we have our annual health fair coming up again, where we will have access to several vaccines provided by the county. We are already locked that down with Christina and her people, and they'll be here to provide several different vaccines, the MMR included. We also have, Seattle and King County Public Health to help with insurance application as well. And then, of course, we are looking for the other resources, like I said, like mammogram, and the vision, dental, and other resources. In December, we started early enough so that we have access to these resources. So just want to encourage the community to come out on that day to access this.
Absolutely. Access those resources. Nurse Janessa, do you have any final thoughts you'd like to leave us with?
Vaccination is very important. It's the key way to prevent measles, mumps, and rubella. Talk to your healthcare provider if you have any questions. Do your research from reputable sources, and talk to your community leaders. Let them also provide you guidance.
Absolutely. And then Assistant Director Carrie Parker, any final thoughts?
I would just reiterate that if you're willing and able, that an MMR is your best protection against a virus like the measles. If you do find yourself in a situation where you're being exposed or notified of an exposure, I know it can be scary, but we're here to support, we're here to help. We have great nurse Janessa that will follow you through the whole process and make sure that you have the resources that you need, and to keep yourself and your family safe.
Yes, right. Well, thank you guys very much. This has been a wonderful episode of the Washington West African Community Podcast. Thank you for listening. Have a great day.